How effective is vagus nerve stimulation in stroke recovery? How effective is vagus nerve stimulation in stroke recovery? This intriguing question highlights a growing area of research in rehabilitation. Vagus nerve stimulation, often abbreviated as VNS, is a technique that sends electrical impulses to the vagus nerve. This nerve is significant as it connects the brain to various body parts. In stroke recovery, VNS is being explored as a method to help the brain reorganize and regain lost functions, particularly for individuals struggling with arm or hand movement after a stroke. There are two primary forms of VNS, non-invasive and invasive. Non-invasive VNS typically involves a device placed on the ear or neck that stimulates the nerve through the skin. Invasive VNS requires a small device implanted under the skin, usually in the chest, with a wire connecting to the vagus nerve in the neck. The invasive method is sometimes referred to as vuvastum, which has been specifically studied among stroke patients. Recent clinical trials and systematic reviews have shown promising results for VNS in stroke recovery. Some studies indicate that combining VNS with physical therapy can lead to greater improvements in arm and hand movement compared to physical therapy alone. For instance, one stroke survivor demonstrated significant gains on a standard assessment of upper extremity function after including VNS in their rehabilitation routine. These improvements are believed to occur because VNS may enhance activity in brain areas responsible for movement, aiding the brain's natural healing and adaptation processes after injury. However, it is crucial to understand that while VNS shows promise, it is not yet a standard treatment for stroke recovery. Most evidence stems from clinical trials and research studies, and more data is necessary to confirm its effectiveness and safety across a broader range of stroke patients. Current guidelines from major health authorities do not recommend VNS as a routine part of stroke rehabilitation, but it is acknowledged as an emerging therapy with potential. In practice, VNS is generally part of a comprehensive rehabilitation program that includes physical therapy, occupational therapy, and other evidence-based treatments. Multidisciplinary teamwork is vital, as stroke recovery often requires input from various healthcare professionals to meet each patient's complex needs. In conclusion, vagus nerve stimulation presents an innovative approach that may assist some stroke survivors in regaining movement and function, particularly when paired with traditional rehabilitation methods. It is not a miracle cure, and its use should be guided by medical professionals as part of a personalized treatment plan. Ongoing research will help clarify which patients may benefit most and how best to implement VNS in stroke recovery. Always consult a healthcare provider before considering any new treatment for stroke.